All right, we're going to kick it off. So thank you for joining us today on this Strategies to Address Transportation Challenges webinar, also known as Developing Mobility and Transportation Supports to Facilitate Access to Employment. We're excited to partner with the National Clearinghouse of Rehabilitation Training Materials and the National Center for Mobility Management. My name is Heather Service, and I'm the project manager for the National Clearinghouse of Rehabilitation Training Materials. And I'm accompanied with Stuart Kelsey and Madison White, who are our project coordinators with the NCRTM. Before we get started, I'd like to share a few housekeeping items. First, we are recording today's webinar session, so please be sure to mute your microphones. If you would like to use live captions, go to your meeting controls and select More Options, or the ellipses icon, which is the 3 dots, then select Turn on Live Captions. To stop using live captions, go to the meeting controls and select More Options, then turn off live captions. Third, if you're using a sign language interpreter, you can pin their video on your screen so it's always visible regardless of who is talking. To pin, select the video labeled ASL Interpreter or SE Solomon 2, which is our other sign language interpreter, and select Pin. Please note that as content is shared, you may need to reselect the ASL interpreter window to make them visible again. If during today's event at any time you require technical assistance, please use the chat feature in Microsoft Teams, or you can email us at ncrtm@neweditions.net, and the presenter will respond to questions at the end of the presentation, and we'll do our best to answer your questions in the chat feature. So to kick things off, I'm going to introduce our speaker for today. Judy Shanley is the Assistant Vice President of Education and Youth Transition at the National Office of Easter Seals in Chicago, Illinois. She supports Easter Seals Network to implement evidence-based transition and workforce development practices and offers innovative solutions to facilitate student educational success. Judy provides technical assistance, conducts research, and develops materials regarding youth transition, workforce development, and accessible transportation. She also developed a transportation education curriculum to ensure that youth have inclusive mobility options as they transition from high school. She has conducted over 100 workshops and professional development events, either in person or using webinar technology. She supports connections across transportation, education, and workforce professionals to develop a continuum of mobility options so that individuals with disabilities can pursue employment and education opportunities as they transition to post-high school settings, and also so that adults can access employment, healthcare, and inclusive community services. Judy is the co-chair of the Transportation Research Board Committee on Accessible Mobility and Transportation and has served as the president of the International Division of Career Development and Transition. Prior to Easter Seals, Judy worked at the U.S. Department of Education in the Office of Special Education Programs, also known as OSEP, and the Office of Post-Secondary Education. She had a key role in implementing the provisions of the Higher Education Opportunity Act to facilitate the ability of students with intellectual disabilities to attend college and secure financial aid. She has over 35 years of experience in the nonprofit human services and research setting, including American Institutes for Research, the ARC, and United Cerebral Palsy. Judy earned her PhD in special education from the University of Florida and an MBA and master's in rehabilitation counseling from Syracuse University. We're so thrilled to have Judy here with us and to share this exciting information for you. So I will now turn the program over to Judy. Take it away, Judy.
Thank you, Heather. Boy, every time I hear my bio, I think, oh my goodness, I'm so old. Let me introduce myself to you. I am a white woman with brown shoulder length hair. I'm wearing glasses and I'm wearing a black shirt, and I use the pronouns she and her. I am thrilled to be with you this afternoon. Thank you to the National Clearinghouse for inviting me to be part of your discussions, and I look forward to having a really great conversation about transportation with all of you. Next slide, please. Today, we're going to be talking about my center, the National Center for Mobility Management. I'll provide an overview for you. We'll talk about some of the coordination challenges that are particular to transportation. And I know that those of you who are in the field and are working in a voc rehab capacity have firsthand knowledge of these challenges. We're also going to talk about solutions. How do we address these transportation barriers? And I want to introduce you to a model that we developed called transportation education. And it's all about providing youth with disabilities, particularly as they transition to post-school settings with inclusive transportation opportunities. I'm going to share with you tons of resources that you could use to support your work to address transportation challenges. And finally, I'll leave time for us to discuss, share, and learn from each other. I typically say in these kinds of workshops, in these presentations, I learn so much from you and from all of your experience that I could take into my learning as I do future professional development. So again, thank you for having me. Next slide. I just wanted to share with you who I am and why I'm doing this work. Heather read you my bio, but I was a vocational rehab counselor for about 8 years. I was a transition professional working with public school districts for about another 6 years. And now I'm a TA provider and I work with individuals across settings, healthcare, education, workforce, to facilitate access to those settings. And in all of these positions, all of these career positions I've had, transportation's always been a barrier. You could be the best folk rehab counselor and find the best job opportunities for individuals and have the best transition programs for youth with disabilities as they leave high school. But if you're not also thinking about transportation and the kinds of mobility supports that are aligned with the needs of individuals, then the outcomes that you achieve are going to be limited. So I'm in this because of all of my diverse background and knowing that infrequently is transportation addressed. And so I'm very excited to be able to talk to you today about that. Next slide, please. So this is a maze. It's a graphic that we call the chaos of transportation. And what it is on the left-hand side of this graphic, it has all of those places that individuals, uh, the, the agencies that support individuals, human service organizations, entities like aging services, the Medicaid program, the TANF program. Then underneath that are all the education-oriented organizations that support inclusiveness and independence, and then the labor organizations, and then all the transportation organizations. On the right side of the graphic are all those places that people need to access and need transportation to access. Things like healthcare, education, employment, shopping, recreation. And in the middle of all this is the individual. Surrounded by the maze of different services, the maze of different transportation providers, the maze of different administrative requirements for all those transportation service, and the individual in the middle doesn't know how to navigate all of this chaos of transportation. And this foundation, this chaos, is what we use to confirm the importance of coordinating human service transportation. And on the next slide, one of the solutions to better coordinate this maze of, or this chaos of transportation, on the next slide, is a solution is the notion of mobility management. And I'll explain to you what that is, but mobility management is really about taking all those pieces, taking all those parts and putting them together in a whole. On the next slide, I provide a definition of mobility management. So you've got this maze. Mobility management is connecting the parts. I talked to you about that. It's of the transportation system. The whole community is engaged in better coordinating all of the services the transportation services that are available in a community and aligning those services with the needs of riders. So you have the customer, the rider, who the client is driving, is the catalyst, is the person that's the decision maker in deciding what services he or she needs. And it's building an entire network. It's organizing that network in a way that minimizes effort for an individual who needs a ride. Right now, there's such disparate transportation services. There's not an easy way to find out or learn about those services. There may not be an easy way to pay consistently across all those services. And mobility management is really about forming a network of all of those providers, all the human service providers, the public, private providers in a community, so that the individual can access those services and the network best meets the community needs. And the next slide, please. My center, the National Center for Mobility Management, is funded to do just that, to help communities implement mobility management networks. We're a National Technical Assistance Center, similar to what the National Clearinghouse is, or maybe another center funded by RSA or OSEP, like the NECTAC-C is a national center. We are a partnership across 3 organizations. My organization, which is Easter Seals, the Community Transportation Association, and the American Public Transportation Association. And our mission is to help states and regions and communities better organize their human services and their transportation services. On the next slide, I wanted to just share with you some of the ways that you could access our free resources. We're all free. We're federally funded by the Federal Transit Administration, similar to what other TA centers have that you might be familiar with. We've got products and tools. We have a blog. We've got events periodically. We have e-learning modules, which are really amazing way for the field to learn about mobility management and find out who those key partners are and the key contacts in your community are. We've got online communities and communities of practice. We also have regional liaisons, people from our staff that you could reach out to. So if you have a question about a mobility management network in your community, or you have a question about a human service transportation provider in your community, you can reach out to our regional liaison. Next slide, please. So here's what you could do to access mobility management. Learn if your state has a mobility management network. You could learn whether your community, your state has a network by going to the NCMM website. We have point people. You could also contact your local metropolitan planning organization or regional council. Also contact your local state Department of Transportation. They would have a good understanding of who the mobility management professionals are. Also, be at the table. Go to the table. Bring your audiences. Bring your participants to the table. I remember I was working with a school district in Texas, and I was working with vocational rehab professionals too that were in the community, and they participated in a local coordination forum that the Department of Transportation hosted. And by them being at the table, the transit agency, the transit provider, learned about a particular need that students have. This transition coordinator and the student and the voc rehab professional wanted to get their participant to a work setting, but there was no transportation. And by the transition coordinator, the voc rehab professional being at the table with the transit providers, the transit provider was able to learn about this need, and they rerouted their bus route to accommodate the needs of the school and the students. But the only way they learned about that was by being at the table. Look for opportunities to address transportation and grants. If you all are involved in grant writing and grant making, include a topic related to transportation, include a focus on mobility. I remember when OSEP NRSA put out those promise grants a number of years ago. I was so hoping that in the priority in the language of that grant, there would be some sort of requirement about transportation. Well, look for opportunities like that where you can address transportation because it's not often thought about. So it's an innovative opportunity for you. Learn from your participants, collect data. I'm a big believer on data driving services that might be in a community. So if you learn from the audiences that you work with that transportation is a challenge, document that. Keep quantitative and qualitative records of that. And then that you could use that to communicate with the transportation decision makers in your community to establish service. And then collect outcome data. So if your participants are using services and they are able to get to work, they're able to get to post-secondary education, keep track of that data. That's a compelling story. I was also working in Ohio, and there was a large employer who had built a manufacturing site in a very rural part of the community. And we had a meeting with local legislators were there, the local transit providers were there, the employer was there, there were human service organizations. I think there was an ARC there was workforce development folks. And the local legislator said, wow, we want the employees of our town to be able to get to work. We want them to be viable and in inclusive employment. I'm going to kick in some resources and some funds I have to establish a service. And the employer kicked in the rest of the money to support a transportation service because that local legislator knew that the only way he was going to keep that business in his town was for people to be able to work there and access the building site. And so he helped contribute dollars to a transportation service and keep those data. That's a compelling story that then you could use if you learn about cases like that. You could use that to communicate with other places and even potentially get more resources. On the next slide, always start with the why. When you knock on the door of a Department of Transportation or another agency and you say things like, we need transportation resources and services, um, they need a compelling story. And this is a quote from a student that I worked with in Chicago Public Schools. We had a student family summit where we brought in students who had been travel trained and were traveling independently and were able to get to work. And the student said, I feel like I'm independent. I don't need to depend upon mom and dad to take me places. Now I can ride the bus to get to my job and to the movies with my friends. And it's all about spontaneous choice, right? It's all about wanting to and being able to go where you want, when you want. So always start with the why. That is a compelling reason for people to be engaged in transportation discussions. Next slide, please. So we're fortunate right now, there's something federally going on that's a catalyst for coordination. And this is a slide, it's got a graphic of like a stick figure person pushing, it looks like he's pushing a wall, and the slide reads a federal catalyst for coordination. On the next slide, the federal catalyst for this coordination is called the Coordinating Council on Access and Mobility. And it's CCAM. I'm going to use the acronym CCAM, CCAM, CCAM. FTA, the Federal Transit Administration, is leading this effort, and it's all about coordinating the federal resources and their state resources around transportation. So the mission of CCAM is to issue policy recommendations and implement activities that improve the availability, accessibility, and efficiency of transportation. And the vision of CCAM is equal access to coordinated transportation for all Americans. So this CCAM initiative is really a driving force and a catalyst for our work across federal agencies. On the next slide. I provide an overview of what CCAM is. So the effort is targeted at improving the availability of transportation service, accessibility, and the efficiency of transportation service. It's really addressing that chaos of transportation, that maze that I shared earlier. And it's focused on particular populations, including individuals with disabilities, older adults, and those with low income. And on the right-hand side of this graphic, this initiative was really started by an executive order in 2004, and it's really evolved over the years. When I worked at the U.S. Department of Education, we called it United We Ride, and now it's called the Coordinating Council on Access and Mobility, or CCAM. And on the right side of the slide, when you look at the organization of CCAM, these are the 11 agencies that are involved. So the U.S. Department of Education is a part of the CCAM effort. And what that means is the Department of Education has made a commitment to focus on the availability, accessibility, and efficiency of transportation for individuals with disabilities. And in fact, they just issued an updated strategic plan. So there's a lot of work going on federally and then carried over to states that's encouraging federal agencies to better coordinate around transportation. Next slide, please. One of the benefits of all of this is there's actually more efficiency in the transportation services that are being delivered. So for instance, if and I remember this picture vividly, someone sent me a picture of 3 vans in front of an apartment, the same building. There were 3 vans. One of those vans was picking up someone to go to a work program. One of the vans was picking up someone going to a senior program, and the third van was picking up someone going to veterans programs. There was one person in each of those vans. How efficient is that? Not very. And so the notion of sharing passengers and sharing rides and sharing funding is all about, that's what CCAM is all about. And it's because of that efficiency, it's making transportation services more accessible and available. The next slide, please. So one of the things, the products that has come out of CCAM, which I encourage everyone to use, I provide the URL at the conclusion of this slide deck. There's a program inventory. And what the Federal Transit Administration did is they went through each of the 11 federal agencies that are part of CCAM, so HHS, Department of Transportation, HUD, Department of Labor, DOJ, Department of Education, Department of Interior, the Veterans Administration, and the USDA, the Department of Agriculture. They went through each of their programs and they found 130 federal programs across those agencies that are grant programs that can support transportation by funding transportation, giving people vouchers, buying vehicles, sharing expenses, providing volunteer driver programs. So you could go to this inventory, and it's an Excel spreadsheet on the FTA website, and actually look and see in your state or community, do any of these programs exist? Can you knock on the door of those programs and say, hey, let's collaborate, let's coordinate. My clients, the people that I work with, have a need for transportation. Can we share resources in some way? Your program allows that resource sharing. So I wanted to draw your attention to the program inventory because I think it's an amazing tool, and NCMM staff actually can sit with you, go through the inventory, help you identify those entities in your state that can support transportation. Next slide, please. The other thing that this CCAM does, it allows for braiding of funds. And I know there's been a lot of work in RSA and OSEP and other human service organizations about sharing and braiding funds. Well, there's a whole tool that FTA has identified for braiding funds. So for instance, if you're working on a Department of Ed grant or a Department of Labor grant, and there's a matching fund needed, potentially DOT monies can be used as a match for that grant if you're focusing on transportation. And conversely, if there's a DOT grant, perhaps some of those funds from another agency can be used to support the match for that project. But I wanted to bring your attention to the fact that there's a product all about braiding federal funds. Next slide, please. So coordination can work. The right people and organizations are at the table, but actually there's no wrong people. I remember being in a meeting in rural Minnesota, and we had all the human service organizations, the VR agency was there, some other Department of Labor officials were there, and there was a chief of police in the room. And I had been to a lot of these coordination meetings before, and I said, why, we went around and each of the professional disciplines explained why they were there, what their interest in transportation coordination was. And the chief of police said, if people in my community don't have access to reliable and safe transportation, they remain on the streets, they're not employed, they're not working, and they do bad things, causing a lot of trouble for my workforce, for my police officers. And so he was at the table because his interest was he wanted people in his community to be engaged and gainfully employed. And so I thought it was interesting. And that's why when I think about being at the table, there's no wrong person at the table. Usually when we work with places, they begin with an action plan or a logic model, some way to organize the effort. There's clear objectives and outcomes, and by that I mean including performance measures. There's some communication, governance in place. The other thing is many states have plans, right? There's a plan for human services transportation. There could be a community health plan. There could be a complete streets plan, an active living, an aging plan. Learn about those plans and see what those plans say about transportation and how you could leverage perhaps some of the activities that are included in the plans. But an important thing about coordination, if you decide to facilitate that coordination in your community, everyone has to share the spirit of coordination. It has to be kind of a passion of everyone's to be at the table. Next slide, please. I wanted to give you some examples I've been doing this work for about 12 years, and here's some of examples that I've come across over the years in which VR and workforce have been at the table. Indiana had a huge mobility summit. I guess it was a year and a half ago, and it was Mobility for All Hoosiers. And this was a quote from the Governor's Council. Reliable transportation is one of the most significant barriers that people with disabilities face as they strive to exercise their autonomy, live independently, and participate fully in their communities. And this was a quote by Jessica Trimble, who was the interim executive director. But they had a big summit on transportation, and Workforce was really one of the big planning agencies of that summit. Next slide, please. The next example is in Maine, and this is relatively new. It's still being tested. The state's Department of Transportation and the Department of Labor got together and they put $3.5 million into a Maine jobs and recovery plan. And they had grants that local communities can apply for. And they called them industry partnership grants. And this is a way it focused on transportation as a solution to improving job recovery and employment in Maine. So this was a really a nice example of two state agencies working together. Next slide, please. Excuse me. The final example comes from Wisconsin. This is more of a local example, very rural community in Wisconsin, and the mobility manager in Wisconsin has a service called Winnebago Catch a Ride, and it serves low-income individuals or people that are living in very, very rural areas of her community, and it's rides to employment. And it's a shared program, a shared cost program by the Department of Transportation. Employers are paying into it, healthcare is paying into it, and they share rides. So it's a service that shares passengers and share rides. And collaboration and outreach are really two instrumental pieces of that program. I included the URL so you can learn more. And this is a program, the mobility manager in Winnebago happens to work for Lutheran Social Services of Wisconsin and Upper Michigan. Next slide, please. Here's a national program. You may have heard of this, Lyft, Uber and Lyft. They have a partnership with National Down Syndrome Society for free rides to employment. It was announced, I think, a year ago, and I think it's still going strong in many communities. It might be something, if you don't have one of these programs in your community, knock on Lyft's door and see what it takes to implement a similar kind of program. Next slide, please. This report, you're probably very familiar with it. It was a framework for community engagement, and ODP, the Office of Disability Employment Policy, just came out with it, and they talked about the programs and services that were integral to competitive integrated employment. And I was so excited to see that transportation was included, and it delineated not in great depth, but it delineated a role of vocational rehab and the CTE folks in transportation, in providing transportation solutions. And I'm hoping that we could over time work with ODP and work with RSA and other federal agencies to really expand this, because I think when you look at it, mental health, SAMHSA has huge supports they could provide around transportation for people to access health care and mental health services. Transportation is a catalyst to that. So thinking about what each of these federal sectors can contribute, I think we could work on that over the years, and I included the URL for the report. Next slide, please. So this just is a quote by Susan Scott in a book called Fierce Conversations. If you always do what you've always done, you'll always get what you've always got. And so thinking about transportation, maybe you've thought about it. Maybe it's been an issue for you to realize good outcomes for the people you work with or the services you provide, but maybe you haven't done anything. Maybe you haven't been active in trying to find transportation solutions. Try something new. Try to do something different. Because if you don't, you'll always be in the same boat with those same challenges. So next slide, please. How many of you have used any of the following to support transportation access for the individuals you work with? Do you have, and these are just kind of questions you can ask yourself when you're thinking about next steps. Have you developed relationships with transportation planning organizations in your community? Do you have relationships with providers, the people that are actually doing the service? Do you know who they are? Do you know what kind of services they provide, and to whom do they provide it? When do they provide it? Do you have relationships with your Department of Transportation at the state or city level? Have you ever tapped into federal and national or state transportation resources? There are tons of resources, and at the end of this slide, I include many more resources besides our center. Have you thought about getting grants to support transportation? Have you identified funding sources? And that's where that program inventory that I talked about could come into play. You can learn whether some of them would provide vouchers to your clients, your participants, where they would provide volunteer driver services. Do you participate in community transportation forums? Almost every community has a transportation forum. They're required by the Federal Transit Administration to get input from the public, and so they have forums to do that. So check out your local planning organization, your regional council, your DOT to find out about those forums and be engaged. Next slide, please. I wanted to just take a little break now. I put a ton of slides after this section about the school transportation education work that we do, but I also want to have time to field any questions that you may have. So why don't we stop and I'll take some questions, and then I could move on to the transportation piece if we have time. And I also wanted to share a couple of resources with you. So Heather, are there any questions in the chat?
Right now, we don't have any questions in the chat, but we'll give members a moment to go ahead and type their questions in the chat. If you're not comfortable with typing it into the chat, you could also raise your hand, and then we could call on you to ask your question verbally. If you want to raise your hand, you can go on the top control bar. There's I don't want to call it emoji, but there's an icon that says reactions, and you can click on that, and then there's a picture of a hand, and you would select that if you would like to raise your hand.
I'll just give it a half a minute. If there's no questions now, I'll move on to the next piece. I've been doing a lot of talking. I want to hear from you all, your experiences. Any of this resonate with you?
Right now, we're not seeing any hands up, and it doesn't appear there's any messages in the chat right now.
Okay. Okay. Well, I'll move on. And if you have questions, put them in the chat and I'll leave some time at the end. So the next slide, please. I am a big believer in, when we're talking about mobility and transportation, starting early. Even by the time a youth gets to transition age, it's almost too late. So start early thinking about how we could educate our youth to think about non-driving options, because not everyone is going to drive. People can't drive. I'm a non-driver. I have a driver's license. I have not driven a car in 12 years. I choose, I'm a choice, they call it a choice rider. I choose to use public transit and private transportation. But starting early is really a key. On the next slide, I work with a lot of voc rehab professionals and transition professionals on pre-ETS work, pre-employment transition services, the WIOA requirement. And when I look at those requirements of both IDEA, the Individuals with Disabilities Education Act, and pre-ETS, there's certain requirements that there's an opportunity to really integrate transportation content into the work of IDEA and pre-ETS. So when you're thinking about implementing a coordinating set of practices, why not take transportation content and build it in academic subjects like math and literacy? Why not heighten students' skill and knowledge of mobility options? Talk about mobility options in math. If you're doing math for a student, if you're an academic educator and you're doing math, why not use a bus schedule to teach addition and subtraction? Or why not use a train schedule to teach time management? And also build connections across students, educators, pupil transportation, and public transportation. And this creates a continuum of accessible transportation options. Students are engaged in decision-making about their mobility choice. And that's what we mean by supporting transportation education. We have math education, we have literacy education. Why not have transportation education? Next slide, please. We built a model. It's this is a graphic of all of the entities that are involved in transportation education. So the whole process is driven by students and families, but at the table are the educators and the voc rehab professionals. You may have safe routes to schools professionals. Pupil transportation professionals are often forgotten about, but pupil transportation professionals and students that are using a yellow school bus, that's really the first um, knowledge building area that students have for using any sort of transportation other than a family car. And then public transportation is at the table. And I call this continuum, building an accessible transportation continuum for students with disabilities to support transition. Next slide. And this is the rationale. You know, I've worked in this field. I'm an educator for over 30 years and worked really hard to create inclusive academic and educational settings for youth. We've got a bunch of policies and legislations, such as IDEA, the tenets associated with access to the general education curriculum, least restrictive environment. We've got all this legislation, the ADA, the Higher Ed Opportunity Act, the home and community-based services is really pushing for inclusive community services. WIOA certainly was pushing for inclusive workforce settings. So why would we think about paratransit as the only option for youth as they're leaving high school? Paratransit is important for many that can't use a least restrictive kind of service, but paratransit is essentially a segregated service. And is it possible that individuals could use a more public service that's an inclusive service? And so when I work with educators, when I work with high school professionals, and I'm talking, you know, they've got to convince their administrators or their community leaders why a focus on transportation education is important. Well, this is why. We want to create inclusive opportunities for all people. Next slide. And this is the why wouldn't we also have inclusive transportation? Indicator 14 is the indicator the Office of Special Education Programs asks school districts to identify placements of where people are, where the students are 1 year post high school. And we know that data is dismal, but we don't really ask if transportation is a reason why people aren't employed or why people aren't in education or higher education. Without independent mobility, youth have no community options. They remain home and isolated. The workforce is also missing a vital piece. We know how individuals with disabilities are underemployed or unemployed. And so the employment sector, our workforce, is missing out on a critical potential labor pool by not having access. Next slide, please. So these are just all the things. These are things you know, you probably experienced firsthand. Lacking knowledge and skills, participants are fearful, families are fearful, right? It's often, you know, the family may have driven their child to and from school. They may have school-based services, and now you're saying to a family, hey, you know, let's think about having your child use a public bus or a community human service transportation mode. And that's scary. That's scary to a lot of professionals, even the VR professionals. There's also lack of communications with public transit, connections with transit. There may be a lack of transportation options in a community. It could be inconvenience for some to use transportation, and then the cost is certainly a barrier. I see there's some questions. Why don't we go on to the next slide? I'll address those questions in about 4 minutes. Just let's move on to the next slide. And I want to this is just some opportunities and ideas for you to be engaged in creating solutions, particularly for youth with transition as they're leaving high school. Next slide, please. I wanted to just touch upon the resources. There are some other ideas. And I never intended to get to all of this content, but I at least wanted you to have some ideas that you could kind of mull around in your own head and with the people that you work with to see whether any of them are viable. That there's a long list of things that you could potentially do here to focus on youth transition and transportation. Next slide, please. I have you can move on. This is ways to overcome fear, cost. These are some examples. I wanted to give you really tangible examples that places around the country are doing to address some of the challenges. This one focuses on cost. The next slide, please. Is again a cost solution in Sacramento. The regional transit district waives the fares for students. So if in your community there is a transit service, a public transit agency, knock on their door and say, hey, maybe my students can get free fares on your service. These are future riders. We're going to give you business in the future. Next slide, please. Here's some more cost solutions. I won't go on to that. Next slide, please. Rideshare, this is very cool. There's a lot of popping up rideshare for youth programs, and many of them are started organically by parents, families and parents that were tired of having to leave work early and drive their children to after school activities. And so some communities have rideshare for youth. So explore whether your community does have such a service. Next slide, please. Here's different mobility options that youth can take advantage of. You know, we think of a bus, we think of a train, but how many of you have seen scooters in your communities? Micro mobility services, we call that. Scooters and bike share. Next slide, please. There's also an Adaptive Driving Alliance. I just wanted to share this resource with you because we do have some individuals who will drive, but they need driving supports. They need adaptive equipment in a vehicle. They may need different kinds of training supports. And so this organization actually finances, not only do they provide training and provide adaptive equipment, but they also finance some of those adaptations. So I wanted you to have access to that resource. Next slide, please. Here's some ideas about what happens if you're in a no service area. I hear that all the time. Very rural areas have no fixed route. Fixed route service is kind of that dedicated transit service that goes from point A to point B. But you would be surprised at how many human service organizations do provide service in very rural and areas that do not have fixed route service. So here's just some suggestions. The next slide, please. Here's our URL for the National Center for Mobility Management. Again, please, we're all free, take advantage of us. The next slide, I included our sister National Technical Assistance Center. The Federal Transit Administration, just like the Department of Education, funds amazing technical assistance centers. We all have our little niche, so explore them. You know, it's outside of your traditional partners, but explore them, find out how you could use the services of those centers. Many of us have grant programs where we provide smaller grant programs around the country, so take advantage of those. And then the next slide is CCAM. All the CCAM resources that I talked about. The federal fund Braiding guide is there, give you some ideas of where you can get matching funds money. The program inventory, again, that's the 130 federal programs. Find out whether any of them could be used to support transportation service in your community. These are all produced by the Federal Transit Administration. And the last slide is my kind of words of wisdom, always try to build connections to support transportation education and look at unlikely sources. We have our traditional partners, but think of transportation as an unlikely source and knock on their door and say, hey, let's figure this all out. We want the best outcomes for all our individuals. So thank you. I have about 7 minutes. I think we could look at some questions. I provided my contact information for you too. I look forward to any follow-up discussions. If we don't get to it today, we can certainly, please reach out to me after the webinar. So, that was a lot.
That's perfect. Thank you, Judy. We do have some comments and questions in the chat. So right after our last question break, we had Lydia who mentioned that you gave great information about Lyft and Able accounts. And then we had a comment from Mike who said, I would just like to say all the things you have said do work. As a result of joining groups, the services we have here for transportation were created. It took everyone getting involved in communities.
Ooh, Mike, where are you? I would love to. That's important story. That's an outcome of getting involved. Type in where you are.
While Mike types that in, Sandy just wanted to know if there would be a recording of this training available because there were some audio issues she experienced. And the answer to that is yes. This training will be available on the NCRTM webpage, and it will be available in just a few days. So keep your eyes out and for that detail. We'll make sure that we send a tweet and we'll let you know when, as a registered participant, when the recording of the training is available. It looks like they can't see your contact information. So what I'll do, Judy, is I'll type it in the chat for them. And so just go ahead and look here in the chat and I'll put it in there for you so you can see it. If there's any other questions, feel free to type them in while we still have Judy with us.
I would love to hear of any of your personal experiences in working with transportation, either providers or planning organizations in your communities. Is that a typical partner for you? Oh, Mike, I see you're from Aberdeen, South Dakota. Nice. You wouldn't think South Dakota would be so plentiful with transportation services, huh? But you've created them, it sounds like. That's wonderful. Do others have that same relationship with transportation? Will you run out and make those contacts? Following this webinar, you're going to find out who your transportation providers is and mobility managers are. Sometimes some people are called not mobility managers, but mobility coordinators, transportation coordinator. It's anyone in your community or at a regional level or even at a state level that coordinates all the transportation services that are there. Some states like Ohio, Wisconsin, Virginia have pretty sophisticated mobility management networks. Other states are still evolving. Indiana is a state that has pockets of mobility managers across the state. Illinois has some, South Dakota has some. But then there are other states who are very much advanced. New Hampshire's pretty advanced. You can find out all of those contacts on the NCMM website.
Perfect. Thank you, Judy. Are there any final questions or any final comments that participants wish to share? You can go ahead and type it in the chat. We're wrapping things up here. Judy, do you have any other final words of wisdom, a final nugget to leave our participants with today?
Just go out and make those transportation connections. We all want the individuals with whom we work to have successful outcomes, and without transportation, they can't. So go make those connections. Thank you. Thank you for inviting me. Thank you all for being so attentive and participatory, and please feel free to reach out to me. Thanks, Heather.
You're welcome. And Judy's contact information is in the chat. It's J Shanley, JSHANLEY at easterseals.com. With that, we'll go ahead and wrap this up. So thank you for taking the time to join us on this webinar to learn about addressing transportation challenges. We invite you to share your feedback and experience and ideas for future topics or events at ncrtm@neweditions.net. We encourage you to follow us on Twitter at RSA_NCRTM and sign up for our newsletter. You'll find most of our important information about upcoming events and new research and available in our newsletter that's published on a monthly basis. Lastly, the National Clearinghouse of Rehabilitation Training Materials is maintained by New Editions Consulting Incorporated and sponsored by the U.S. Department of Education and Rehabilitation Services, RSA, under contract number 9190021C0033. However, these contents do not necessarily represent the policy of the Department of Education, and you should not assume endorsement by the federal government. Thank you again, and have a wonderful rest of your day. This concludes today's event.